tell us a little bit about our community outreach program.
Sure. So one of the things that
And I think we have a slide on that, Lee, if you wouldn't mind putting that up.
So part of the strategic plan, we looked at 4 areas: physician alignment, quality and service, community partnership, and financial sustainability. Community partnership was really about getting outside the walls of the hospital and making a meaningful impact on the quality of life. So addressing what many of us will talk about as social determinants of health. You know, these are the areas in which may not necessarily be directly linked to healthcare delivery, but impact healthcare delivery and the patient's ability to follow the physician's orders or to adhere to their health regimen. And so it's things like food insecurity, access to health care, safe housing, education, job opportunities, literacy, access to medications, and those things that aren't necessarily health care but impact health care. And they're so important in communities like Nash County, Rocky Mount, and small rural communities that we really wanted to make sure we were investing in it. We partnered with our Board of Commissioners and then the Nash UNC Health Care Foundation. We partnered together and we embarked on 2 programs that we're seeing a great deal of success with, and I'm very proud of our ability to offer to the community. One was an inpatient food pantry. I think we saw a little bit about that at our break, and the work that Dee and Kirby are doing to make sure that we're identifying through EPIC those patients who come into our hospital as an inpatient who qualify or are determined by a survey that of questions, a battery of questions that they may be food insecure. They're offered a diet, medication sensitive diet of food to take home after they leave the hospital. Is for 3 to 4 days to feed, help them with their family and their food, so they don't have to focus on food and they can focus on their quality of life improvement, rehab, medication.
Very often people will come home from a specific surgery and they can't have foods that they're not used to not buying. They just may have had stomach surgery, for example, and they have to have a different type of diet. So you provide specialty foods for people who require that, because sometimes they have to make a choice between medicine or food.
Sure. And
right?
we also link them up to other community food banks. So we've partnered. So this isn't a competition. This is, we're really extending and putting these individuals in.
Getting them started.
Getting them started, extending that and putting them in contact with other community food banks and services. Then our community paramedic program is made up of 3 paramedics that, again, through the partnership with the foundation, has helped fund. We identify either the physician, a staff member, or case manager may identify that the patient may have some additional needs after they're discharged. Our purpose is really never to discharge the patient, just help them transition from the hospital to home. And that community paramedic really helps that transition. So the community paramedic, I've had a chance to go out and shadow and ride with the community paramedic. The days that I went out with them, we talked about medication with the patient, how to take medication. We helped them. A simple example is we found a patient eyesight wasn't good enough to read their insulin measures, so we got them some larger lettering on their syringe, or got pre-filled syringes so they wouldn't have to do that. So those are small examples, but those examples, if they're not taken care of, is how a patient ends up back in the emergency department or back into the hospital.